Hypnosis can be broadly categorized into several types, each with unique characteristics and applications. Some types include Ericksonian or clinical hypnosis, self-hypnosis, stage and street hypnosis, and traditional, direct hypnosis. Named after Dr. Milton H. Erickson, Ericksonian hypnosis is a form of hypnosis that emphasizes indirect suggestions and metaphors. Unlike traditional methods, which often involve direct commands, Ericksonian hypnosis uses a more conversational approach. One of the Ericksonian techniques is encouraging resistance. Encouraging resistance gives the patient the power and allows them to withhold information that they don't want to tell. A double bind is a technique where an individual is presented with two choices, both of which lead to the same outcome. This method helps in managing resistance by making one choice desirable and the other less so. For example, in an interrogation setting, an individual might remain silent until frustration leads them to respond. In therapy, this technique might be used to guide a patient toward a desired outcome, while allowing them to feel they are making the choice. Seeding ideas is a technique that involves planting ideas into the patient's unconscious mind through metaphors, contradictions, symbols, and anecdotes. By embedding these ideas subtly, the therapist helps the patient access these concepts at a deeper level. Emphasizing the positive focuses on finding the positive aspects in every disability or problem behavior. This helps in reframing issues and encourages a more constructive mindset. Additionally, the handshake induction is another Ericksonian technique. Handshakes are so normalized that they can aid an individual into a trance. This technique starts with a strong and normal handshake. Then the process is interrupted by loosening the strength of the grip and brushing specific fingers against the participant's hand. The confusion technique is also an Ericksonian technique that is used to confuse the patient with vague language patterns, complex topics, confusing words, metaphors, and jokes to distract the patient's conscious train of thought. Shock therapy, which can be controversial and unethical, involves startling or surprising a patient to induce a change in behavior. An example of shock therapy is lighting a fire inside the house of someone with agoraphobia. Creating a stressful situation to force a behavioral change is considered highly unethical and potentially harmful. In addition to Ericksonian techniques, there is also self-hypnosis, such as meditation, which allows individuals to induce a hypnotic state on their own. This technique is often used for personal development, stress reduction, and self-improvement. Stage and street hypnosis are also seen as another hypnosis technique. Stage and street hypnosis are performed for entertainment purposes and are characterized by exaggerated and dramatic displays. While they showcase the power of hypnosis, they are often less focused on therapeutic outcomes and more on engaging the audience. Additionally, traditional or direct hypnosis is another technique. Traditional or direct hypnosis involves giving clear, explicit instructions to the patient. This approach is more straightforward than Ericksonian methods and is often used for tasks like habit control or pain relief. The therapist directly tells the patient what to do, such as, "You will feel relaxed now," or "You will stop smoking." Hypnosis encompasses a wide range of techniques and applications, from the therapeutic approaches of Ericksonian and clinical hypnosis to the more dramatic forms of stage and street hypnosis. Understanding these different methods allows practitioners to tailor their approaches to meet the needs of their clients effectively. While some techniques, like shock therapy, are controversial and should be approached with caution, others, such as self-hypnosis, offer valuable tools for personal growth and well-being.